There are a few things to think about when you choose to start learning to drive with type 1 diabetes. Firstly, it is important that you notify the DVLA that you have type 1 diabetes, the confidential medical form DIA-B1. One of the most important things to think about while you are driving is the possibility of having a hypo whilst you're at the wheel, which could cause you to have an accident. This could cause you to be charged for being under the influence of insulin. Even a mild hypo could affect your driving. Legally, you should test your blood glucose 30 minutes before you start your journey and then every 2 hours off your journey. Your blood glucose levels need to be at least 5 to drive. If blood glucose is between 4 to 5 millimoles, you should have a snack containing carbohydrates before you start driving. You also need to make sure that you have a hypo treatment and a snack with slow-acting carbohydrates in your car. If you feel as though blood glucose levels are low, stop driving as soon as it's safe to do so. Remove the key from the ignition and get out of the driver's seat. Do not check glucose levels or treat your hypo whilst you are driving. You should wait 45 minutes before rechecking your blood glucose. Once your blood glucose level is over 5 millimoles and you feel normal, it is safe to start driving again. If you have had a severe hypo whilst awake in the last 12 months, or a hypo requiring third-party assistance, you will also need to inform the DVLA of this. Group 1 drivers, cars and motorcycles, can now rely on reading from a glucose sensor, but you must always carry your blood glucose monitor with you. You must still use a finger prick reading to confirm your blood glucose if your blood glucose is below 4 millimoles, when you have symptoms of hypoglycemia, or when your symptoms do not match your sensor reading. If you drive or are planning to drive a bus or lorry, you are still legally required to test blood glucose.